Hey you guys, welcome back to my channel. Long time no see. But I really know it's been a while since I've been on here. Sorry, I'm trying to like scooch down so you guys don't see the glare that's on my glasses. And you can't see my eyes, but I just wanted to give you guys an update, provide you guys an update on what's been going on. So I just wanted to cycle through all the feelings that I have been feeling being a new grad before I came back on here to give you guys an update and just give you the realness of what has been going on. So this month, February, marks 6 months that I would have been a nurse on a med-surg floor unit. 3 shifts per week, or 3 days per week, 12-hour shifts. And I feel better. It's not 100% great, but I feel better. There have been days where I have driven to work just in a deep, deep depression, just sad about having to go in, feeling incompetent, feeling like I can't do this anymore. I don't know how I'm going to make it to the year mark. I have encountered more rude doctors. Nothing as rude as the last video that I have recorded, but still rude. Just needless rudeness. I've encountered nurses who seem like they don't really want to help me. I've encountered, just pushing forward despite all of that. I've just, despite all of that, I've asked my questions. I've done what I needed to do to get my shift done with, to get my patients the care that they needed. I still pushed through. The things that have helped me, there are a number of them. I guess I can do a video about that and ways to reduce anxiety for new grads, because there is a lot. I know I'm not the only one. Something that has helped me is knowing that one of the new grads that works there and is in the residency program with me and also went to school with me, she has switched from days to nights because day shift just got so overwhelming for her that she had like a nervous breakdown, I think she said, and she just wanted to be on nights to have that time to kind of think through her care and think through what she's doing. But she switched and she is on day shift with me my weekends, and I feel so good about that, just to see a familiar face and to know that we are sharing the same struggle, and to depend on her when I need her and her to do the same for me. It's been wonderful. We went through December and November, which was a hot mess because we were low staffed, and so they were calling us left and right every night to ask if we would be able to come in for an extra shift for pandemic pay, which is the highest pay that they offer. And I didn't pick up not one shift because I'm not doing that. I'm not going to burn myself out so that they can give me extra money and so that I won't be able to spend time with my family and furthering them and not fixing their staffing ratios. But this month, or the end of December, they started to get better with that. They hired a lot more travel nurses and a lot more new nurses. And so you see them on the floor being trained by other nurses. And it seems like with this mix of travel nurses and new nurses, like the atmosphere has gotten better. Their attitudes are really nice. So it's nice to see different staff and to meet new people. I think what was going on was just on my floor. And when I was floated to other floors, the COVID floors, and meeting other people that I haven't met, new charge nurses, it was just a breath of fresh air, because it was just talking and chopping up with other people that were more understanding of my plight, more understanding of what we go through as new grads, and that have been nurses for a while. So they had a more relaxed attitude, not relaxed about patient care to the point of being dangerous, but like an understanding of, this is the concept, do it the way you want to get to that outcome, but this is the concept, and I'm not going to stress you out about when to call ER back about an admit. just the little things. So it seemed less stressful. They were more in a more teaching attitude than they were about like punitive, you're doing it the wrong way type of attitudes. Hopefully that makes sense. In addition to that, a nurse that had been gone for a while, I guess, who was on leave, she was a charge nurse. She came back, and she is my more frequent charge nurse when I'm working. So, and she's awesome. She's there for everyone. She's an older charge nurse. Has been a nurse since they were smoking in hospitals, and she's just about helping others. She lets us know when she doesn't really know something, which is very inspiring, to hear somebody say, I don't know, but let's find out together. So she's been helping, and that has really like brightened my mood about going to work, looking at who the charge nurse is. That charge nurse who yelled at me, she like treats me better now. I don't know if she had an epiphany, but she treats me better now. I've built some relationships with more nurses, and it's good just to talk to somebody, have somebody to talk to, because I really don't talk to anybody about what I've been going through outside of the job, because I don't think anybody understands. I mean, I do have a sister-in-law who's also in a new grad residency in Texas, in the ICU, and I don't know, I just don't want to burden her with my problems. She might be doing great, because I see her as like an all-around great person who might be doing better with her residency. And if I come over there and I bring her down with my crap, I don't want to do that to her. So maybe one day when I see her, kind of open up to her about it. But like right now, I don't know. I don't want to rain on her parade, or if she's having some of the same feelings, I don't know. Maybe I should open up to her. She might be having some of the same problems. I want to know that somebody's in the same boat. But whatever. That's where I am. I keep it to myself. But it is hard for me to have to go to be on night shift. I enjoy night shift because there isn't a lot of hustle and bustle that there is on day shift. But at the same time, I hate having to leave my family at 5:30 to make it to my job. 5:30 at night. Like, that's when I just want to cuddle up with a good book or get warm and have some dinner and go my butt to sleep. Put the kids to sleep, go my butt to sleep, or like watch something late night. I don't want to get ready to go to work. I'm not in that mindset. That's the hardest part for me to get over. Driving to work and like being in the mindset to take care of somebody else. And once I'm at work and I hit the ground running, I have my whole day set up of how I want it to go, how I need to get over that 9 o'clock hump. Hopefully get things done by 10 o'clock as far as med passes, and or even 12 o'clock, get past 12 o'clock and the vitals and the meds of everything that needs to be done, so I can sit down and just like figure out what else needs to be done. I've gotten a handle on most of my time management. I am not sure if I'm doing things right, because sometimes meds don't scan, and so I'll mark a box for like medication cannot be scanned. I don't know if I'm going to get in trouble with that, but nobody has given me feedback thus far. Am I charting everything? That's still a question. As far as time management, I have developed methods, because I noticed that when I come in, there will be times when a certain day shift nurse won't have assignments up, and so I have like 5 minutes left before my shift actually starts to look up however many patients I'm assigned to, and that's not much time. I just write down my meds and have no idea what's going on with the patient until I get report. And sometimes report is choppy, and I don't blame the nurses or anything, because sometimes my report's choppy as well. But I've developed methods to make sure that I don't fall behind. If I see that I have 4 patients assigned to me, I know I'm going to get a 5th admit at some point during the night. So I try to do my best, depending on how many meds are due and what I need to do within those first few hours that I hit the floor, to chart when I'm in the patient's room. Then I move on to the next patient. I try to allot at least 30 minutes per patient if I have 4 patients. at the beginning of the shift. If I have 5 patients, then I try to allot a certain time between the hour of 8 and 10 to all 5 of my patients and get my charting done. But if I have 5 patients, I'm more prone to like maybe chart on 3 while I'm in the room, and then save the last 2 charting for some time during the shift. So I've learned ways of time management that have been effective for me. So that way if I have 4 patients and I get that 5th admit, then I know I'm already caught up and I don't really have to stress out about, getting this 5th patient. But things have been great. I've been exposed to inserting an NG2 more than once and placing it correctly, inserting Foley catheters, straight cathing people, blood transfusion. I know how to do it. I've only done it one time, so I haven't been exposed to that again. So to know that I know how to do it and set it up completely. But at the beginning of becoming a nurse, I know how to do it. But I would like exposure again while I'm on my own. Just management of different conditions, like my knowledge has grown substantially. What different doctors want from you, my knowledge about that has grown substantially as well. As far as Capella, I finished the program already. I started on November 9th, I think, and then I finished on January 28th. I finished with my capstone and everything. My capstone was about creating this sheet for new grads that would help organize their workload, because I know that's one of the stressors of being a new grad. You're with your preceptor, you have no idea what the hell is going on, and you're just reliant on your preceptor to tell you how the day is going to go. But it's nice to have a sheet that kind of tracks at least the medications or what you're supposed to do during which times throughout the night. And I know everybody uses a different sheet, but I came up with this one sheet for new grads. So it's like, I don't know how they do it at different hospitals, but at our hospital, there's just like what do you use? And this dependence on your preceptor to like give you something. And oftentimes it's not geared towards new nurses, it's geared towards seasoned nurses. And so we have no idea what the hell that is. So I created this sheet for my capstone. I made it through the whole program with all A's. Excuse me. So I'm just waiting for my diploma to be conferred, which they said will take 6 to 8 weeks. And the online graduation will be on March 27th. So I'm very excited about that. Happy that I got it done. They said that my graduation date will be the last date of the month in which I finished the program. So January 31st will be the date on my diploma. And then I'll go back to my hospital and get more pay for a bachelor degree, BSN RN. And next steps. I have been looking into FNP programs. I guess I'm going to take that next step. Which program, I don't know. They're all pretty freaking expensive, and I don't want to deal with that. I've made it thus far debt-free. Paid Capella. Capella was what? I think Capella was like $2,300 for me out of pocket after financial aid and discounts and things like that. So it was nice to get my bachelor's debt-free. All I did was take the money that was refunded back to me from Sac State, which is the state university I was attending before, and just used it towards Capella. But anyway, that is that. I am almost officially a bachelor degree RN. If you want a video on Capella, I could do that. But yes, I'm thinking about going into FNP programs, and it's just kind of going from there. I don't want to be a bedside nurse. I don't want to do that. But I will have enough experience if I work and do a part-time FNP program. If I work at the same time, and I will get more and more experience under my belt as a bedside nurse. But ideally, I'd like to, after a year passes, go to an outpatient office setting, so that I can have experience with that, which I think would be important if I'm an FNP not working in an acute care setting. I mean, if I want to work in an office setting as an FNP, I would need some outpatient experience there. So that I'm looking at that too. But anyway, yes, I cycle through some feelings of depression. I still do, but it's lightweight. I've developed some methods of coping. Meditation has helped me. Various things have helped me, and now I'm just grateful. I'm taking it one day at a time, and eventually I will hit that 1 year mark. As far as the residency program, haven't really gotten support from them. They had this whole schedule for us, but for the past 2 months, they have canceled on us our 1 day a month that we're supposed to attend because they've been busy training all the influx of new nurses that have been coming in, and travel nurses and new nurses. So they've canceled on us, so we haven't had that support there for the past 2 months. And I've just learned to not compare myself and to give myself some sympathy, and to know that I have gone through shift keeping my patients alive the best that I could. I've dealt with flack from nurses that have given a report to, like, they want to question me more than usual and keep me over, and like, I don't know what that's about. But yeah, other than that, things are getting brighter, and I'm just so grateful to God about it. That's all I can do is just like pray before I go in and ask him for the strength to get this shift done. And then when I come out on the other side the next morning, it is a fulfilling feeling that I've done all that I can. But it is exhausting. Night shift is exhausting. But anyway, hope you guys enjoy this update. I know this is rambling. I'm sitting here in my pajamas and my robe. It's the only way I know how to be when I'm not at work because I'm tired most of the time. Tomorrow I will work another night shift. They have started going back to normal at my facility. So like they have, the best thing happened. I was scheduled to work Monday and Tuesday. Today is Thursday. I did my Monday when I got off of work. I called staffing and I asked to be on the low census list, which is basically if they have low census or not a lot of patients. If you're on that list, they will, and you're scheduled to work, they will call you and ask you if you want to come in or you don't. It's okay. It's low census. Enjoy your night. So I called that morning when I got off of work and I said, can you please put me on the list for tonight, Tuesday? And they were like, yeah, sure, we'll put you on the list. They had no idea what number I was or anything because they didn't have access to the list yet until 11 a.m. And by that time, I'm going to be knocked out. And so Tuesday night rolled around. I woke up around 4:30 and I got dressed and had my little coffee and went downstairs. Got ready to leave at 5:30. My 3-year-old was crying because he didn't want me to go to work. And I'm like, oh. But I get in my car, take my phone out because I usually listen to like a sermon on my drive there. And I noticed I get a missed call from staffing. Listen to the message, and she was like, you're on the low census list. I just want to know if you're interested in coming in or not. And call me back. I called her back and she was like, are you still interested in low census? I said, yes. She was like, okay, honey, enjoy your night. That was the best feeling ever. I got out that car, ran into my house. It was like, that's the best thing happened. I don't have to go to work. And yeah, so I'm going to use that low census list. Probably not as much because it is valuable to be at work, especially for me, to learn all that I can. But sometimes it is hard to just be at work. This job is physical, it's taxing emotionally, it's draining physically, all that. I don't know how nurses do it for these people that have like 30-year-long careers. Especially at bedside. I gotta do something else, and I am going to be doing something else. But anyway, I don't doubt that being an FNP is the same amount of work probably. I don't know, but not going into it for that reason. I just feel like there's a lot of people out in the community that could use an FNP's care, especially when I look at some of these doctors and how rude they can be and not taking the whole person, because I've seen doctors be rude to patients as well and disregard their opinions. Not all of them. Some of them are very nice, but a lot that I have encountered have not been. So I hope to make an impact there and a difference. But anyway, rambling. Hope you've enjoyed this update. I hope to put out more content. If you want to know more ways on how to, I'll probably put out a video on some ways to like reduce your anxiety if you're a new grad, how to organize your shift, things like that. Anyway, thank you for watching. Have a great rest of the week. Bye.